Hi, this is Yvonne McNary with Central Kentucky Television, and I'm here with Dr. Bart Dawson, who is a cardiologist here at Springview Hospital. And he is also the medical director for cardiac rehab here at Springview. How are you doing, Dr.
Doing
Dawson?
great. Thank you for having me.
And thank you for being here with us today because we're going to talk a little bit about women's health, women's hearts, and how they differ. Give us a little information.
So, heart disease still in this state still the number one or number two killer of folks, and so being aware of not only your risk factors but whether you have heart disease is very important for both men and especially women. Certainly the first thing is to know the symptoms that we might look out for heart disease. When you think about the classic signs of heart disease, meaning coronary artery disease, blocked arteries in the heart, you think of a chest pain, typically a pressure, squeezing sensation, can sometimes associate with left shoulder, left arm discomfort, radiate to the neck and jaw, and cause shortness of breath. Specifically with physical exertion is a pretty classic sign, but folks can have atypical symptoms, including women more statistically. So nausea, pain between the shoulder blades and back, fatigue, shortness of breath, not always exertional in nature, not always your classic description. That needs to be paid attention to, especially in women, because it may lead to more testing that might identify heart disease when you don't think that's initially what's going on.
Okay. Now, what are some things that we can do to try to avoid heart problems?
So the first and foremost is know the risk factors that you can modify. And so a lot of that involves your routine primary care visits where you can be screened for conditions that otherwise would be completely silent. So knowing your blood pressure, knowing your cholesterol numbers and whether they need to be treated, certainly whether you're at risk for or have diabetes, kidney disease, carotid artery disease in the neck, plaque in your neck vessels. Those can be high-risk markers for heart disease as well. And certainly lifestyle modifications can also improve your outcomes from heart disease and lower your risk of developing it.
Okay. Let's talk a little bit about diet and exercise.
Okay, so exercise definitely to keep your cardiovascular system in shape does two things. One, it lowers some of the risk factors and risk of developing those risk factors that might lead to heart disease later. So improving blood pressure control, blood glucose and sugar handling in the body, maintaining a healthy weight. But the second thing it does is if you do develop heart disease, the more fit you are at the time that you have a heart attack, for example, the more likely you are to survive that heart attack and also maintain more of your heart function from being damaged from a heart attack. So it's very important not only for prevention but also for the survivability of heart disease.
Mm-hmm. And what about that diet?
So with diet, it's really hard to say in an individual what their diet is going to do to their heart risk. But statistically, we know that diets that are high in saturated fat, high calories, and therefore putting weight on people lead to metabolic syndrome changes that can lead to heart disease. But in the more last 2 decades, there's been more focus on high carbohydrate diets as well, because that creates some changes hormonally in our body involving insulin and other mediators that can lead to the development of bad cholesterol in the body and also develop into heart disease. So fat-free and low-fat doesn't always mean heart healthy,
Okay.
and it's something that we need to educate ourselves more on.
Okay. And what about that yearly visit to the doctor's office?
Yeah, the annual visit to the primary care doctor is really helpful because it's going to easily tell you whether you have the major risk factors for heart disease. Certainly we know whether we smoke or not. I mean, that's a primary risk factor. But the other major risk factors, high blood pressure, cholesterol, diabetes, those are things that are not going to cause any symptoms. They have to be discovered by screening and visits to your primary care doctor. So those are very important to know whether you need to be treated for some of these risk factors.
Okay. Now, if you would give us those risk factors again, as far as what I should look for in heart attack symptoms.
So the classic signs would be for a heart attack, the sudden development of chest pain, typically in the center of the chest, typically a squeezing or a pressure. It can sometimes radiate to the left arm, left shoulder, left neck, and jaw. It can be associated with sweating, feeling a profound sense of doom at times, shortness of breath, and these symptoms can occur suddenly at rest. More stable heart disease can present with those same symptoms, but the symptoms may just be milder. They may happen only with physical exertion but go away with rest. Non-typical symptoms that you should also know about would be the development of intermittent nausea, where you might think it's just heartburn, pain that's between the shoulder blades and the back, worsening shortness of breath, worsening fatigue. Some of these can be more nonspecific, but can definitely be heart symptoms.
Okay. Well, listen, thank you so much for talking to us today, and I'm sure that the information that you've given us will help lots of viewers out there to prevent heart problems. This has been Yvonne McNary with Central Kentucky Television.